Hi, everybody. This is Dr. Britt Talley Daniel, MD. I'm a neurologist and headache doctor, and doing a podcast today on migraine and depression. Now, migraine headache occurs in 12% of the American population, and 20% of women and 6% of men have migraine headache. 10% of persons in America develop depression. Migraine headache is the 5th most common cause of disability and the 10th most common cause of visits to the emergency room. The 3 most painful conditions known are migraine, a kidney stone, and childbirth. Migraine is a complicated neurologic process involving the ganglia of the trigeminal nerve, the cerebral arteries, and the thalamus. In the process, 3 inflammatory and vasodilating neurochemicals are released: neurokinin A, substance P, and calcitonin gene-related peptide, which is abbreviated as CGRP. Serotonin neurotransmitters located on the trigeminal nerve and the cranial arteries are reduced during migraine. So low serotonin levels are also linked to depression. So migraine and depression, they are comorbid medical problems, and comorbid means that 2 medical conditions occur more commonly together than by chance. So migraine and depression are 50% comorbid, and this means that half persons with depression have migraine also. The exact reason for this relationship is currently unknown. The instance of the connection with depression is higher in persons with migraine with aura and with persons with migraine who have a medication over headache. So what's the definition of migraine? Well, migraine is a recurrent headache disorder manifesting in attacks lasting 4 to 72 hours. Typical characteristics of the headache are it's one-sided, pulsating, moderate or severe, so on a level of 1 to 10, it's 5 to 10, aggravation by routine physical activity, and association with nausea and or sensitivity to light and sound. The International Classification of Headache, 3rd Division, has diagnostic criteria, which are you have to have at least 5 attacks of migraine. The headache attacks last 4 to 72 hours. The headache has at least 2 of the following 4 characteristics. It's one-sided, throbbing, moderate or severe, aggravated or causing avoidance of routine physical activities such as walking or climbing stairs. And during the headache, you have to have at least 1 of the following, either nausea or vomiting, or photophobia and phonophobia. The definition of depression, according to the Diagnostical Manual of Mental Disorders, 5th version, says a person who suffers a major depressive disorder must either have a depressed mood or loss of interest or pleasure in daily activities consistently for at least a 2-week period. This mood must represent a change from the person's normal mood. Social, occupational, educational, or other important functioning must also be negatively impaired by the change in mood. A depressed mood caused by substances such as drugs, alcohol, medications, or which part of a general medical condition is not considered to be a major depressive disorder. Major depressive disorder cannot be diagnosed if a person has a history of manic, hypomanic, or mixed episodes, that is a bipolar disorder, or if the depressed mood is better accounted for by schizoaffective disorder, it's not superimposed on schizophrenia, schizophreniform disorder, delusional disorder, or psychotic disorder. Further, the symptoms are not better accounted for by bereavement after the loss of a loved one, and the symptoms persist for longer than 2 months or are characterized by marked functional impairment, morbid preoccupation with worthlessness, suicidal ideation, psychotic symptoms, or psychomotor retardation. So the DSM-5 list of symptoms for depression is the patient's mood must be depressed most of the day, nearly every day, as indicated by either subjective reports, that is, the patient feels sad or empty, or observation made by others, that is, they appear tearful. In children and adolescents, this may be characterized as an irritable mood. You have to have markedly diminished interest or pleasure in all or almost all activities most of the day, nearly every day. significant weight loss when not dieting, or weight gain. That is, a change of more than 5% of the body weight in a month, or increase in appetite nearly every day. Insomnia or hypersomnia nearly every day. You sleep all the time. I can't sleep. Psychomotor agitation or retardation nearly every day. Fatigue or loss of energy nearly every day. Feelings of worthlessness, excessive or inappropriate guilt nearly every day. Diminished ability to think or concentrate or indecisiveness nearly every day. Recurrent thoughts of death, not just fear of dying. Recurrent suicidal ideation without a specific plan or a suicide attempt or a specific plan for committing suicide. Related comments. The age of onset. Well, migraine usually starts in mid to late adolescence, or peaks in the 30s and diminishes after that. Middle-aged women aged 40 to 59 years old have the highest rates of depression. The lowest rates of depression are seen among teenage boys age 12 to 17 and men over the age of 60. Sexual preference. Women have migraines 3 times more than men and depression 2 times more than men. Genetic link. Major depression increased the risk of migraine, and migraine increased the risk for major depression. This bidirectional association with each disorder increasing the risk for first onset of the other was not observed in relation to other severe headaches, like tension headaches. Migraine is thought to be genetically linked, but polygenic in origin. This means that multiple complex gene relations are found with migraine. Now, there is a rare condition called familial hemiplegic migraine that's known related to genes, and those are listed on my webpage. If you want to go there and look that up, it's under drmigraine.com. The familial forms of hemiplegic migraine are referred to as FHM1, FHM2, and FHM3, respectively. And each one has a mutation of a different gene. Now, depression has around 50% of cases where the cause is genetic or related to heritability. The other 50% of cases of depression are unrelated to genes, but due to conditions that seem to predispose to depression. And those are loss of a parent in early life, severe childhood physical or sexual abuse, childhood emotional or physical neglect, or severe life stress. Epidemiology. Migraine affects approximately 12% of Americans each year. Migraine is 3 times more common in women than men. That's 20% for women and 6% for men. Migraine attacks peak in prevalence between the ages of 25 and 55. Migraine is a chronic disease which occurs episodically. Other psychiatric relationships. Major depressive disorder occurs 2 to 4 times more frequently in migraine patients. Lifetime rates of major depressive disorder range from 22% to 32% among those with episodic migraine, or as high as 57% among those with chronic migraine. And chronic migraine is defined as 15 headache days a month, 8 of which have migraine features. Migraineurs have a 3 to 4-fold increased risk for bipolar disorder and for suicide attempts. Among migraine sufferers, anxiety disorders are twice as common as depression, and migraineurs have a 3 to 5-fold increase in risk for various anxiety disorders compared with controls. Panic disorder, phobias, post-traumatic stress disorder, and generalized anxiety disorder are most common among migraineurs. There's no current evidence that improved control of depression helps to control migraines. However, it's important to identify and treat depression in patients with migraine because it's a significant predictor for migraine chronification. Furthermore, migraineurs who suffer from depression are more likely to be refractory to migraine treatments and suffer from medication overuse and disability. Depression is by far the most prevalent, representing 99% of all mind-brain illnesses, of all psychiatric illnesses. Schizophrenia and major psychotic illnesses representing the remaining 1%. The umbrella of depression encompasses major depressive disorder and its related mood disorders, including bipolar disorder, postpartum depression, post-traumatic stress syndrome, anxiety disorder, and suicide. Depression in the United States affects over 18 million adults. That's 1 in 10 in any given year. Depression is the leading cause of disability for ages 15 to 44 years old. Depression is the primary reason why someone dies of suicide, which is about every 12 minutes, and over 41,000 persons a year. Homicide claims less than 16,000 lives every year, according to the CDC data in 2013. Depression in the workplace causes 490 million disability days from work each year in the United States, and it accounts for 23 billion in lost work days each year. It takes an economic toll over $100 billion each year from U.S. business. Depression internationally affects over 300 million people worldwide, regardless of culture, age, gender, religion, race, or economic status. Depression is one of the most debilitating conditions in the world, with severe depression rated in the same disability category as terminal stage cancer. Depression is the leading cause of disability worldwide, is a major contributor to the overall global burden of disease. Now, at the end of this talk, I'll make a comment, which is my personal thoughts on SSRIs and SNRIs. These are drugs for treating depression. And these drugs work well for depression, anxiety, post-traumatic stress disorder, and panic disorder, but they do not work for migraine prevention. There's a lot of misinformation about that, but the data really has never shown that. So this is the end of my talk on this subject. I have more about it on my webpage, as mentioned. Please click subscribe down there so we can keep in touch with each other. And God bless all you people out there who are depressed and who have migraine headache. I'll check you on another talk.